Hi, my name is Rawan. I graduated from Westfield State in 2023 with my BSN, and straight from there I became a registered nurse in the Heart and Vascular Critical Care Unit at Bay State Medical Center. I am a first-year PhD in nursing student at UMASS Amherst, where I also TA for the undergraduate BSN classes. I'm also an assistant instructor in the simulation labs at Westfield State. I did not know I wanted to be a nurse until my senior year of high school. So I did not have a lifelong dream to be a nurse. It never even occurred to me to go into nursing until I was looking at applying to college my senior year of high school. I knew I wanted something in healthcare, so I job shadowed a bunch of occupations, a physical therapist, an occupational therapist, a physician's assistant, and then during that job shadow with a physician assistant, actually, I found myself hanging out with the nurses. I was missing that face-to-face interaction with people, so I just kind of snuck away from the PA and I found myself hanging out with the nurses, and they took me into their patient rooms, and then I just loved all that's involved with nursing and being a nurse. And then shortly after that, I found myself applying to nursing school, and now here I am. I became a nurse the traditional route. I went straight to a 4-year BSN program straight out of high school. I knew that I wanted to be very involved with both things nursing and not nursing. I was also a double major with nursing and Spanish, and I completed a concentration in language, culture, and literature. Throughout my 4 years at Westfield State, I was a tour guide, an ambassador for the urban education program, which is now known as the Lead Scholars Program. I was in the nursing club throughout my whole 4 years, and my senior year I was class president of the nursing club. I also graduated as a Commonwealth Honors Scholar and completed a year-long independent research project. There is so much to being a nurse. I knew I wanted a career where every day was going to be a little bit different, and I wanted to work a job that came with a commitment to lifelong learning. Specifically about critical care nursing, I love how involved it is. Critically ill patients is a huge part of what I do. I take care of patients that have come straight out of the OR and they just had open heart surgery and their chest was literally just closed, and now here they are, and I am simultaneously working the ventilator and I'm titrating a bunch of drips, speaking to the family about, what's going on and what things are normal and what's going well. And it's just such an amazing career. I get to be an advocate, I get to be an educator, I get to be a caregiver. There's just so much about it that you get to be involved with. One word of advice for someone who's looking into nursing as a career: I would absolutely job shadow, because that's what did it for me. It's one thing to Google roles and responsibilities of somebody who is a nurse or what their salary is, and it's a whole other thing to actually see it real time, because nursing is something that's hard to verbalize or to word in a textbook or a Google search. It's something that's dynamic, it's something that's involved, and I really would just encourage seeing it in real time and seeing different nurses in different capacities, because nurses are everywhere. They're not just at the bedside in the hospital setting. They're at homes, at schools, at anywhere really you can imagine. So definitely just take the time to see what it's all about real time.